What is up, gay people? I forgot my glasses at one of my friend's houses, so I'm not wearing them, and I haven't been wearing them. I also saw cats yesterday, so I'm in kind of a funk. A good funk. Currently 2 weeks out from surgery, so I've been taking one 300 milligram iron supplement a day and one probiotic pill a day. The iron is to help boost your hemoglobin and red blood cell count before surgery, and the probiotic is to help your gut bacteria be good for surgery. That also means that I have to start avoiding things that thin my blood out, so that's like a lot of anti-inflammatories like aspirin and Advil and stuff like that. Tylenol's okay, so I also have to avoid random foods that also potentially thin out my blood, like ginger and green tea and chamomile tea and stuff like that. I have a whole list of things that I have to avoid, so I'm doing that. I also am not supposed to do any drinking or smoking. Happy New Year's Eve, by the way. But I don't do either of those anyway, so I'm okay. My surgeon also gave me the option to choose whether or not to stop testosterone 2 weeks before. Where I'm at with that is there's been some studies that say that taking testosterone can increase your chance of getting blood clots. But there's also been studies that say that it doesn't affect it at all, or it helps it. So what I'm going to do is sort of feel it out, I think, because if my hormones get out of whack, I get really depressed and irritable, and that's not a good thing to have before surgery. So I think I might stop 1 week before instead of 2 weeks before, but as I said, my surgeon said it was up to me, so I'm going to make that decision for myself. Obviously, follow what your surgeon tells you. Also, I went to my family doctor pre-op appointment, which cost like $80, which is stupid, but capitalism. And I was cleared for surgery, so I'm good to go, basically. I have a bit of a cold right now, which I'm a little bit worried about, so I'm probably going to go to a walk-in clinic in the next couple of days to make sure that I'm not dying or have like a sinus infection or whatever. You don't need to know this. This is just a mess. I'm feeling nervous, obviously, because I'm having surgery. That's a scary thing. I've never had surgery before. That is sort of making my anxiety go crazy a little bit. I'm still managing, thankfully, but I'm just a lot more sensitive right now when it comes to anxiety-provoking things. But I'm definitely coping and definitely making it and doing my best, so it's gonna be okay. To know that after surgery I will obviously need time to recuperate, but also will have that downtime to sort of chill out. So now I'll show you the things that I got to prepare for surgery. I got a loofah on a stick, all my prescribed medication from my surgeon, and that includes high pain painkiller, a low pain painkiller, anti-nausea medication, antibiotic, and I think some stool softeners just in case. I also got some cohesive medical tape and some large non-stick gauze pads for dressing afterwards, because I'm not sure if my surgeon will give me things to dress my wounds afterwards, so I have those. I also got baby wipes because you can't really bathe for a little while, or at least a couple of days, so I can use that on like my armpits to make sure that I don't smell like garbage. I also got some nitrile gloves, which are good for dressing my wounds and stripping my drains, and I might need help with that, so I got that for like my mom to help with that if I need it. Also for Christmas, I was generously gifted a bamboo lap tray, so I can use that in bed for food and my laptop. So I'm very excited about that. Also, obviously the things that I mentioned in my past video, hauls, a pill separator, and compression socks. The only other things that I'm planning on getting are acrylic piercing retainers. So I have my septum pierced and an ear piercing. So I want to get acrylic retainers for those, or at least non-metal ones. So if I get cauterization during surgery, it doesn't zap them. I might have to take them out anyway. It depends on your surgeon. So I'm just going to play it safe and get them just in case. I also want to get a neck pillow for obvious reasons, I guess, sleeping. And maybe an antihistamine, but I haven't really decided yet. Maybe. I don't think there's anything else, so I will leave you with that. Hopefully next time I will have my glasses so I can see things. Goodbye.